I'm Bernard Osende. I'm a director of Malaria Partners Uganda. I'm also a board member of Malaria Partners Uganda. We are here in Mbale and in Nabuyonga Primary School because we chose to celebrate World Mosquito Day today, the 10th day of October. Whereas the official day of World Mosquito Day is 20th August, but we chose to celebrate it today, and it was being led by Malaria Partners Uganda. We are trying to we have had a stake engagement meeting with the different people whom we feel can touch the community. We have had a community engagement with Boda Bodas, with the market vendors, with the civic leadership and political leadership, and even the VHTs, among others, so that they can take this information of awareness, advocacy, and campaign against malaria, so that we can prevent the spread of malaria. The reason is because in the recent times, whereas in the whole Uganda, Arua and around the Lake Victoria has the biggest number of people infected with malaria, Regional Referral Hospital and Mbale city has been having the biggest number of deaths. And in Uganda, around 14 people die daily of malaria. And that is a full minibus, or what we call a kamunye. And that is not good information for us. So we are advocating with other stakeholders to ensure that we prevent the spread of malaria.
Which is specific information?
Information we gave to the stakeholders was, one, to appreciate that malaria is a big problem in our communities. That malaria is still the biggest killer, and it kills more than HIV, and the mosquito is the biggest danger and one of the most dangerous animals in the world, because it is a female Anopheles mosquito. When it spreads malaria, many people die. Children die, pregnant mothers die, students die, and even workers die. And you know that whenever somebody has malaria, he cannot work. If he's a student, he cannot go to school, and it has been affecting very many people. So we thought, using the religious leaders, the Boda Boda, the civic leaders, the political leaders, we can touch the masses, and even the students. We had even skits, poems, and songs to help us really advocate against malaria. It is high in Uganda for many reasons. And I told you that one of the biggest challenges we have in Uganda is, health training. The systems of health are not strong enough. Because you need to investigate, or maybe test, treat, follow up, and even follow up the family. That is not going on. Two, we told you that one of the things is resource-based. Human resources, the financial resources, the equipment, and even some test kits are not there in many areas. The tablets are not there. So resource-based is also a problem. But also we know the knowledge base. Many people know about malaria, but they don't know how malaria is spread, how you can prevent it, how you can cure it, and how. And then we're also working against areas where the fallacies, there are so many fallacies. Other people interpret malaria as witchcraft, especially cerebral malaria as witchcraft. Then other people interpret malaria as maybe other diseases, is confused by other diseases. So we are thinking that if we kill some of these fallacies and some of the things, it is going to really help. And we wanted also to work on the mindset of the stakeholders, so that they take this information ahead to the communities, so that we can prevent malaria.